Assalamualaikum and hi everyone. I'm ADYANI binti Muhammad REDZUAN from Faculty of Pharmacy, Universiti Kebangsaan, Malaysia. I'll be presenting a research entitled Features of Digoxin Toxicity in Atrial Fibrillation and Congestive Heart Failure Patients, a Systematic Review. A bit of introduction about digoxin. The drug itself have long-standing use in clinical practice. The digoxin compound has been first isolated in the 1930s. There are two main indications of digoxin. First being for the management of patients with heart failure, impaired systolic function, and continue to have signs and symptoms despite standard therapy. And secondly, for the management of atrial fibrillation with or without heart failure. Although considered generally safe, there has been studies reported that digoxin have the potential of pro-arrhythmic properties, long-term effects on cardiac remodeling, and even linked to adverse prognosis in atrial fibrillation. Because of the narrow therapeutic index in nature, close therapeutic drug monitoring is indicated to ensure the safety and efficacy of digoxin use. Patients who were prescribed with digoxin need to be closely monitored for side effects, and the level need to be kept within therapeutic range to prevent the increasing risk of digoxin-associated mortality. The general objective of the study is to provide detailed analysis on currently available case report related to digoxin toxicity. For specific objective, we want to investigate the clinical and lab manifestation associated with digoxin toxicity and to identify any risk factors presented leading to digoxin toxicity, for example, renal impairment or possible drug-drug interaction. In terms of search strategies, the database that we used were PubMed and Ovid. In terms of keywords, we used digoxin and toxicity to search both of the database. We included all case reports involving human in the recent 10 years from 2010 to 2020. All the articles must be in English or translated study in English. The article must contain the dose of digoxin, possible interacting drugs, risk factors, together with presenting symptoms of digoxin-associated toxicity. We excluded any titles and abstract which contains digoxin and herbal interactions. All of the studies were assessed for quality assessment using Joanna Briggs Institute Critical Appraisal Checklist for case reports. As you can see from the slide, these are the detailed information that has been extracted from the case reports. We extracted the information regarding author, year of publication, and the source of the journal. Patient demographic including age, gender, and detailed presentation in terms of the case were also recorded. Characteristic of digoxin therapy and also possible cause of digoxin toxicity, together with the risk factors of the occurrence of digoxin toxicity, were also included. For results and discussion, based on the PubMed search, we managed to find 1,827 articles. And based on the Ovid search, we found 572 articles in total. After applying the inclusion and exclusion criteria, we managed to get 80 articles, and one article has been removed because of the duplication. All of these records were screened and 62 articles were excluded because of the inaccessibility. And finally, we managed to get 17 articles. From these, 7 articles were excluded because they were found to be irrelevant. And finally, 10 studies were included for the final qualitative synthesis. From our systematic review, we found that there are four main indications of digoxin. First being atrial fibrillation, followed by congestive heart failure, dilated cardiomyopathy with left ventricular ejection fraction, and proximal supraventricular tachycardia. The dose of digoxin being used varied from 0.0625 mg up until 0.25 mg. We found that 60% of the cases reported the actual occurrence of digoxin toxicity caused by drug-drug interaction. Listed here are the list of the papers which reported possible interaction of digoxin with diuretics being used, and these include loop diuretics, potassium sparing diuretics, as well as other diuretics as well. The main mechanism of how digoxin interacts with diuretics involve the interaction with the electrolyte disturbances. For example, thiazide and loop diuretics would lead to potassium and magnesium deficit, whereas with potassium sparing diuretics, they would induce changes in the kinetics of digoxin, increasing the digoxin plasma concentration by inhibiting tubular secretion of the drug itself. Regarding the presenting symptoms of digoxin toxicity, we found three main characteristics reported from the case report. First is nausea and vomiting, second is bradycardia, and third is change in vision. In terms of nausea and vomiting, 70% of the cases reported digoxin toxicity induced GI-related symptoms, and nausea and vomiting is the most commonly presenting features of digoxin toxicity. Some patients may develop bradycardia, which means their heart rate falls less than 60 beats per minute. Some had change in vision, and these include flashing lights, disappearance of color vision, and sometimes visual hallucination can appear as well. These are examples of the summary for all the case report indicating presenting symptoms associated with digoxin toxicity that we have extracted. Looking at risk associated with digoxin toxicity, we found three factors that can contribute to this problem. First is renal insufficiency, followed by advanced age and hypothyroidism. In terms of renal insufficiency, underlying renal or kidney problem could lead to the occurrence of digoxin toxicity. This is because kidney is the main organ that eliminates digoxin from our body. A study found that nearly half of the patients with digoxin toxicity were suffering from renal function reduction, and therefore digoxin blood levels need to be checked regularly, especially for elderly patients. Looking at advanced age, it's definitely one of the risk factors as well, because advanced age patients, they tend to have more comorbidities. And there's also age-related decline in renal function and a decrease in volume of digoxin distribution, which could lead to patients becoming potential to develop digoxin toxicity as well. Finally is hypothyroidism, because thyroid problem definitely could alter digoxin pharmacokinetics. A hypothyroid state reduces both volume of distribution and clearance, while hyperthyroid state increase both. In conclusion, we found that digoxin is most commonly prescribed for the treatment of atrial fibrillation and congestive heart failure. The dose range being used includes 0.125 mg or 0.25 mg. Diuretics is most commonly reported as one of the drugs that can cause interaction with digoxin, and there were a few mechanisms that has been proposed, and one of it is electrolyte imbalance. There were a few common symptoms associated with digoxin toxicity. Mainly they are related to the GI, like nausea and vomiting. Others include change in vision and bradycardia. Risk factors associated with digoxin toxicity include female, elderly, possible drug interactions, together with renal problems. With that, I thank you for your attention.